Scanning the room.
My name is Tiffany, and I'm going to be demonstrating IM and ID injections. First, I have checked my lab values for the patient. I have obtained my doctor's orders as well as my MAR. So the first thing I need to do is I need to compare the two for discrepancies. So we have Shirley Cost 45, Shirley Cost 45, date of birth 5/14/64, date of birth 5/14/64. The doctor has ordered a PPD test, and over here on my MAR I have PPD diluted 0.1 mil intradermal once, and he has ordered ceftriaxone 250 milligrams intermuscular OD. Over here I have ceftriaxone 250 milligrams intermuscular OD. Then we have phentergrin 25 milligrams intermuscular BID twice a day as needed. Over here I have phentergrin 25 milligrams IM twice a day as needed. So these two are the same, so I am going to go into the meds room and I'm going to grab my meds for the patient. And I am going to double check that I have the right medications for the right patient, which is Shirley Cost 5/14/64 and Shirley Cost 5/14/64. So now I am going to perform hand hygiene, and I am going to pull out the meds as my first check. And the first one is the PPD. So I am pulling out a sterile water to mix with my tuberculin. And then I have my ceftriaxone 250 milligrams. This is an anti-infective. So I have my ceftriaxone. This is a powder, so that is 250 milligrams. It is going to have to be diluted with the water, and then we will have to perform dimensional analysis. And I have my sterile water for that. Next I have my phentergrin, which is an antiemetic, and it is 25 milligrams. And I have my phentergrin, and that as well is going to have to be dimensional analysis, as this is 1 mil and it's only calling for 25 milligrams. So I am going to get out my needles and all the other supplies that I'm going to need. I'm going to get some alcohol wipes, and I'm going to need Band-Aids, and I am going to need some gauze and labels for my needles so that I know which is which after I draw them. Okay, so setting this off to the side. Okay, so I am going to don my gloves. And make sure I have my pen. And the first one we're going to do is going to be for the PPD. So I want to get my sterile wipes ready and get my tuberculin. I'm going to pop the tops. And I am going to get, my needles ready. That's my draw needle. And that is the one I'm going to use. So first thing I want to do is I want to disinfect the tops of these in a circular motion. do the other one. Okay, so this is my tuberculosis with my sterile water. This is for my tuberculosis test. We are going to open the needle. And we're going to attach the draw needle. Okay, and then I'm going to mix 3 mils of water into the powder. So I want to draw back 3 mils of air. And I'm going to poke that straight in so the needle doesn't touch the water. We're going to push that in. And then I am going to tip, and I am going to draw back 3 mils of water, getting rid of any air bubbles. And we are going to mix this directly into the powder. And I'm going to recap. And this is going to go into the sharps container. To mix this, I'm going to gently roll this between my hands. And we're going to check to make sure all the powders have dissolved. We want to make sure that the color is correct for what it should be. So now I'm going to take my TB needle and we are going to draw 0.1 mils. So first thing I'm going to do is I'm going to draw back. .1. And I'm going to insert, pushing in the air, tipping up, and drawing 1 mil, 0.1 mil. I will tap out any air bubbles. I am going to recap. And I'm going to tag. And then I'm going to place this on my tray. And, okay. So I would dispose of those in the proper way. Next, we are doing the ceftriaxone, 250 milligrams. Intramuscular OD, this is the anti-infective. And this one I have done my dimensional analysis on. So I know that I am going to be pulling 1 mil. But again, I am going to take the tops off of these. I'm going to get my sterile wipes. And I'm going to disinfect the tops. Okay, and then I'm going to get my needle. Maybe. Oh, come on. And I'm going to get my draw needle so that I can mix my sterile water with my powder. I'm going to take the top off carefully. I am going to draw back again, 3 mil. I am going to put that in my water so that it does not touch the water. I'm going to push in my air. And then I am going to withdraw 3 mil. Again, tapping out any air bubbles. Pushing out the air. I am now going to put this into my ceftriaxone. Pulling this out. I would recap. I'm going to dispose of this needle into a sharps container. I am going to attach the injection needle, and then I'm going to again gently roll between my hands to make sure that the powder is completely mixed. Again, checking the color, making sure that it's what it should be. So for this injection, we are doing 1 milliliter, which I have determined after doing my dimensional analysis. So I'm going to draw back . 1 milliliter of air. I am going to put it into my ceftriaxone. And now I'm going to draw back. I guess we're gonna tip so that we can get it all. It's not.
I think it's the mixture.
It is not wanting to come out. Yeah,
Try
it is.
mixing it a little bit more, maybe.
Let's see if we got. I can't get it to draw. Okay, so that would be 1 mil if I could actually get the liquid to come through the needle. We would tap this out, get out the air bubbles. I am going to recap. And I am going to label. And place this on my tray. And I would dispose of these in the proper way. And last but not least, I'm going to be doing my 25 milligrams of Phenigrin. And again, I have done my dimensional analysis, knowing that I only need to pull 0.5 mils out of this. So first thing I'm going to do is I am going to disinfect. And then I am going to take my 2-inch cotton square after I tap everything down to make sure there's nothing in the top. I am going to put this around, and I am going to pull this towards me so that the glass breaks away from me. And this would be discarded into a sharps container. Okay. I am going to get my filter needle. And I'm going to attach it here. I am going to draw back 0.5 to the 1/2 mil. No, actually I'm not. No air goes into this one. So this one I'm going to turn upside down. And I'm going to draw out my 1/2 mil. And then this I would discard in the sharps container. I am going to make sure there's no air bubbles. And I am going to take this one off, discarding in a sharps container, and I'm going to attach my injection needle. And then I will label this one. Okay, so now I have all of my injections drawn. So I would go into the patient's room with my meds, discarding my gloves into the garbage. I'm going to go in, perform hand hygiene, I have my MAR and my meds. I'm going to come in, I'm going to introduce myself to the patient. I am going to check the patient's name and date of birth. And she told me that her name is Shirley Cost, which I have her name here as Shirley Cost. She was born 5/14 of 64, 5/14 of 64. I have explained to Shirley that we are going to be administering her meds. Her first one is going to be the PPD. And we are going to be doing 0.1 mils intradermally. And I have donned gloves. I have my sterile wipe, my alcohol pad, and I'm going to go from the inside circular to the outside. And then we are going to let that dry for about 10 seconds. And I am going to get my PPD 0.1 mil with my PPD 0.1 mil. And we want to go, we're going to pull the skin taut, and we want to make a wheel. So after I've done that, I would take my pen and I am going to draw a circle around it. I would put my initials, I would put the date and the time so that when the next nurse comes in, they can see when it's been done. Okay, and now I am going to be, I would administer next the ceftriaxone, but we did that just for video purposes. So now we're going to do the Phenigrin, and we're going to do that intramuscular. So I want to have my gauze, and I want to have a Band-Aid. So we're going to set that right there. I need to get an alcohol wipe. And we are going to wipe the skin from the inside out in circular motion. Again, we're going to let that dry. And now I am going to 3 fingers down from the Chromium process. So I'm going to go right about here. I would pull down. I am going to inject till the hub's in. I would let go. This is the Z, and I'm going to slowly inject. And then this would be discarded into a sharps container. I have a Band-Aid that I would place over. Little massage. And I would check with Shirley and see if there was anything else that I could do for her. And if she has no questions and everything is good, I would clean up my mess and I would leave the room.